Could you describe a typical day when you first started practicing?
I started in the summer of 1946 in the office of a senior doctor who took pity on a young guy who didn't have any money. I practiced in downtown Worcester, and my practice came mainly from doctors on the staff of Memorial Hospital, where I was a member, referring patients, and gradually over the years patients referred other patients to me. My office charges were $3 and house calls were $5.
Okay.
My first year in practice, I didn't think I'd be able to pay expenses, but unbelievably I made a little over $10,000 with all expenses paid, which today seems almost incredible.
Yes.
But that's the way it was.
And did your typical day change over years of practice?
In the early days, I used to make house calls, maybe 15 a week, calls at night. Over the years, gradually that diminished, particularly as the emergency room came into prominence. I had many less calls for emergencies, particularly at night. In the early years, I used to take care of patients in their homes, such as an uncomplicated coronary. I'd see them every day or every other day, take cardiograms in their homes, and I never had a fatality under such circumstances, although I realize today a doctor who took care of a coronary at home would be at severe risk of liability if anything went wrong. So over the years, house calls declined, nursing homes came into prominence, and the district nursing became very, very expert in taking care of patients discharged from the hospitals. So I would say in the last 10 or 15 years of my practice, I never had to get up at night for an emergency. Patients would go to the hospital emergency room if they had chest pain or anything that was obviously bad.
Right.
And the other thing is that over the years, the residency programs, particularly at Memorial Hospital where I was, were very excellent. We had a close relationship with the interns and residents. Sometimes they would stay with us, stay in our homes when we went away. I knew them very well. As years progressed, that intimacy with the residents became less, and there was a change that required the residents to have much more responsibility, which I didn't particularly like, because I didn't like the idea of not being completely in charge of my patients. It was good for the residents, but I had the feeling that the patients were getting too much care from the residents, and there was a tendency in the teaching program for the doctors to allow the residents as much responsibility as they could. It made for excellent teaching, but that was just one of the changes in the practice. So towards the end of my practicing career, I had the feeling that I didn't have as much control over the care of the patients as I had originally.
What were your hours like?
What?
What were your hours like in a typical day of practicing?
My hours would start at maybe 7:30 at the hospital, making rounds. I used to have somewhere between 6 and 12 patients in the hospital. After rounds, I would make house calls as necessary. I was home for lunch every day, sometimes for only 10 minutes, but it was very nice for the family, particularly me and my wife. From 1 to 2 every day, I went to the Morgan Construction Company as a medical advisor. This was a very rewarding thing. It started my first year and furnished a guaranteed income, which was always good as an anchor to windward. At 2 o'clock, I would start my office hours and usually go until 5:30 or 6, sometimes later. On an average, I used to spend 15 minutes with a patient, sometimes more. I used to see somewhere between 8 and 12 patients in the afternoon. I spent a lot of time talking with patients, and that is something that today would be impossible. Today there's very, very little intimate contact between doctor and patients. House calls I found very, very interesting. Some people were so interesting that I'd find myself spending a half an hour or an hour once I'd dealt with their medical problem. But I got to know people, and people, particularly interesting people who otherwise I never would have known. That was one of the real riches of the kind of practice I had.
Did you use the telephone to talk with patients often?
I had a lot of telephone calls to the distress of my wife. I never charged for a telephone call, and I gave out advice which might have been dangerous in today's litigious world. As a matter of fact, I did charge one woman. She came to the office, took a half an hour, and called me 3 or 4 times a week for 2 weeks and talked 20 minutes. I sent her a bill for telephone calls and never saw or heard of her since.
Who were your patients?
Who were my patients?
Yes.
They were a combination of middle class and upper class, if you can use that word. I had a lot of friends in the community who were in businesses, presidents of banks, other companies, and they would refer patients to me. I saw a lot of presidents of the universities in Worcester and some of their faculty. I had black patients, Spanish or Latin American patients. My wife and I had taken 3 years of Spanish at Assumption College, and when the Latin American people began coming here, I had Spanish people coming to the office because I could get along with them in the language, which was sort of interesting.
Did most of your patients live around Worcester?
No, I had quite a few patients referred from the valley, Uxbridge, Northbridge, Whitensville, Douglas, and quite a few from the Southbridge area in Webster.
Did patients have the chance to choose their physician?
Yes.
What do you think it was like for your family to have a physician in the household?
The what?
What do you think it was like for your family to have a physician in the household?
I think they found it annoying, particularly when I'd have a telephone on the table. We were eating meals, and the telephone would ring, and I'd have to tell somebody how to deal with diarrhea while my family was eating. It interrupted family times. I remember one Christmas dinner I was called out on an emergency. But they got used to it. My wife took the burden of it, though, because people would call the house, she'd answer and refer them to wherever I was. She knew where I was all the time.
So she was sort of your receptionist then?
Yeah, she was wonderful.
Did you have any vacations during the course of your practice?
That was one of the things that I insisted on.
Good.
And in the first year of our practice, I said, we're going to take a trip to Bermuda with some friends. My wife said, we can't afford it. I said, we're going to go anyway. So we went, and we managed. And then one very interesting thing happened. A patient that I'd been taking care of died and left me $2,500. I took it to the broker and said, I want to take a trip, but if I do, the money's gone. I want you to take this money, invest it, and double it every year, and I'll take a trip every year on $2,500. He did that for 10 years, sometimes tripling it. So for 10 years during the 50s, we had a trip every year of 2 or 3 weeks, mostly to South America.
What made you decide to become a doctor?
When?
No, what made you decide to become a doctor?
Oh, I wanted to be a doctor ever since I was 10 years old and walked around with my grandfather making house calls. Never changed my mind. And in fact, I wanted to go be a doctor so bad that I didn't go to Harvard with my classmates in school because I knew that too much partying would be an interference, and I had to get good marks so I could get into Harvard Medical School. So I went off to the country college up in Williamstown, Williams.
And what made you decide to keep being a doctor once you had started practicing?
I enjoyed it. I enjoyed seeing patients. I enjoyed helping them. I was fascinated by the science of medicine that was developing so rapidly.
Why did you choose to practice in Worcester?
My sister had married one of my best friends who lived in Worcester and was living here. I took an internship in Worcester, and after getting to know a lot of people here, and particularly falling in love with a Worcester girl, I decided this was the place to practice, and it certainly was a good choice.
Do you have a favorite memory from when you practice?
A favorite memory?
Yes.
My most favorite memory is seeing my wife, this young girl, standing on the beach as I was on a raft, meeting her and falling in love with her. You can't beat that.
No, you can't. Do you have a least favorite memory?
Yes, that's when my fourth son was killed in an automobile accident.
Okay, I'm going to move on now to the
What?
science of medicine. I'm going to move on now to the science of medicine. What were the most typical illnesses that you dealt with in the 1950s, 1940s?
The most typical illnesses, I would say, were peptic ulcers, upper respiratory infections, high blood pressure, those, and neuropsychiatric problems.
Okay.
I was very interested in psychosomatic medicine, and I saw a lot of those problems.
And how about in subsequent decades did the illnesses change?
The curious thing is that over the years, there were less and less peptic ulcers occurring. For what reason, I never could find out. I used to see 2 or 3, or maybe more, a week, and in the last few years of my practice, I hardly saw any new ulcer patients. The biggest change was in the treatment of something like high blood pressure. In the early years of in the late 40s, early 50s, there was no treatment for blood pressure. And I remember seeing a man 44 with a blood pressure of 160 over 120. We had nothing to treat him. Phenobarbital, nothing helped. I said, this guy's going to be dead in a year, and he was. He had a heart attack a year later. Now that kind of patient doesn't die. Blood pressure medication and treatment has been one of the most remarkable things, along with heart surgery.
What was the greatest challenge for you to treat when you started practicing?
What was the what?
What illness was the greatest challenge for you to treat?
Well, curiously, I felt that my greatest challenge was in psychosomatic problems.
Yes.
I had an exposure to that in Boston in medical school with Dr. Soma Weiss, who was my greatest teacher. And he put an emphasis on the functional aspect of symptoms. And I was ready to identify this kind of symptom in patients. And it was a great disappointment to find over the years that the treatment of people with psychiatric problems or neuropsychiatric problems was very, very poor. I think the medical profession has failed in the area of psychiatry. If it wasn't for the psychotropic drugs, things that we didn't have 50 years ago, I'd hate to think what would be going on today.
When you stopped practicing, what do you think was the greatest challenge for doctors to treat in your field?
When I stopped?
When you stopped practicing, what illness was the greatest challenge for doctors to treat in your field?
Tuberculosis.
Okay.
When I started practice, tuberculosis was the biggest killer of teenage children, teenagers. In my class at medical school, 3 out of 120 developed TB. And over the years, TB has been wiped out. Of course, along the same lines are the streptococcal diseases and lobar pneumonia. 1 out of every 4 people with lobar pneumonia died when I graduated from medical school. And one of the exciting things as I was starting my internship was the development of medicines that would cure lobar pneumonia. The first was sulfamethyl It was a sulfamethyl drug. And this man came in with some man bit a big hunk out of his shoulder, and he came in with a positive Staph aureus blood temperature 105. You knew he was going to die, but I got some of this sulfamethyl thiazide, I guess it was, gave it to him, and temperature came down and he survived, but he developed a foot drop, which he had permanently. They took the methyl group out, and the next was sulfathiazole or sulfadiazine. They came in, and they were much more manageable. And then came the rabbit serums for pneumonia. I'd have to get up at night when a pneumonia patient came in and type the sputum for type 1, type 2, or type 3, and give them the appropriate rabbit serum every 4 hours intravenously. It worked beautifully, and those people survived very nicely. And then, of course, in 1939, when I graduated from medical school, people, particularly children, died of strep throat. They would develop Bright's disease and rheumatic fever. There was a whole hospital in Boston for children with rheumatic fever. A wonderful place to learn to hear murmurs. It doesn't exist anymore. People don't have Bright's disease anymore. Amazing, with the advent of the antibiotics, the treatment of sore throats, strep throats.
And what, in your opinion, was the most important breakthrough in disease treatment during your career?
Well, of course, I think the overall biggest thing is the development of antibiotics.
Yes.
Then comes steroids. Then, of course, the developments in surgery were incredible. In 1939, there were only 2 surgeons in the country who opened the chest. The development of chest surgery and open heart surgery has been a tremendous advance in treatment.
And how about in disease prevention? What breakthroughs have you seen there?
I think of well, of course, the vaccines for polio were amazing. But then the epidemiologic attack on tuberculosis was equally amazing. Somebody comes in with cavitation, spewing bugs out. The public health people would examine everybody that person came in contact with at the office, the family, and maybe out of 20 people, they'd take chest x-rays and find that 2 or 3 of them had coin lesions. And those people would be treated immediately and never got to cavitate and spread it to other people. So gradually, there was nobody spewing TB bugs around, and that's why, along with the treatment with streptomycin and so forth, TB has been essentially wiped out, except for AIDS people.
Right. What was the worst epidemic that you can recall?
I think the worst one was the polio epidemic in 1948.
Could you describe attitudes towards smoking and cancer throughout your career?
Well, in the early days, there wasn't much attention paid to it. I used to think that when you came across a patient in the hospital with cancer of the lung, it was an interesting patient. But then a few months after I started interning, my father called me and said he had cancer of the lung. And at that point, cancer of the lung no longer became an interesting problem. It was a human tragedy. And I have always been very conscious of the problem of smoking more in connection with emphysema than cancer. But of course, over the years it's been shown that smoking has a very bad effect on the heart. So between coronaries, emphysema, chronic obstructive lung disease, and lung cancer, it's been a very significant fact, and I've paid a lot of attention to it with my patients over the years.
In terms of technology, what is something that doctors take for granted now that you did not have in your career? There's so much.
CAT scans, MRI, Holter monitors, all the technology, echocardiograms, all sorts of things that we didn't have back in the early days. You'd hear a murmur and you'd guess what it was. Now an echocardiogram will tell you exactly which valve is involved.
So mainly in the field of radiology.
What?
Mainly in the field of radiology.
Oh, the field of radiology is incredible. The invasive procedures of radiology, amazing what they do now.
What technology is still being used today that you used in medical school?
X-ray.
And can you describe one important invention that you've seen throughout the course of your career?
What's that again?
Describe one important invention that you've seen throughout the course of your career in medicine.
Well, of course, intubation of patients for anesthesia is one of the most unrecognized yet most important advances in the treatment of surgical patients. Nobody would think of operating on an 80-year-old with major surgery at that time, but now they'll do it in their 80s and even 90s. I had a man, a good friend of mine, with 94 years old, had a coronary bypass last year. Played golf with him 2 months later. So that things like that are really impressive. Holter monitors have done a great deal for reducing sudden deaths because they lead to the pacemakers.
Yes. Did you always have access to the new technology being used in medicine?
I was lucky.
Is there anything that you would like to see invented now?
Yeah, I'd like to see a mechanism invented whereby intravenous antibiotics could be given in the home setting. One of the biggest changes in practice over the years has been the way hospitalization has decreased. 50 years ago, a patient with a coronary would be kept in the hospital 6 or 8 weeks. Patient with a gallbladder, uncomplicated, 2 weeks. I had my appendix out when I was 18. I was in the hospital 2 weeks, uncomplicated. Now, people stay 1 or 2 days with things. It's amazing. When I retired from practice, I did peer review work. I worked for Blue Cross, Blue Shield in Boston. I worked for Mass Pro, examining records of patients in hospitals to see whether patients have been staying too long, whether their admissions were justified. At Blue Cross, nurses would refer requests from doctors to admit a patient with this or that problem. I'd have to decide whether it was justified. particularly if they wanted a pre-op day. And then I'd have to decide whether a patient had stayed beyond a reasonable length of time. That's one of the changes in medicine.
What were some of the most important drugs that you used in your practice?
Early on,
Yes.
phenobarbital, theophylline, morphine, chloral hydrate for sleep. Never heard of it, probably. Digitalis leaf, these little balls of foxglove. There was no gravimetric where you could tell how much they were getting, so there was digitoxicity was frequent. Now, of course, digoxin, lanoxin, 1 milligram, 2 milligrams, you know just exactly how much you're getting, so you don't see digitoxicity much these days.
So many of those drugs aren't still used today?
Well, I used to use Valium, and the use of morphine has declined. I used to use morphine frequently for cancer patients. It seems unreasonable today, but at that point, when somebody was terminal in the hospital, you could write the order MS, grains a quarter, Q4H, and the nurses would give it whether the patient was awake or not. And of course, they'd usually end up with slow respirations and gradually die after a couple of days, which was merciful. You can't do that today. And I think that's a big problem. But at any rate, those are the things. There's not very many things I was taught in medical school, pharmacology, that I used in my later years. Aspirin was taught, but we didn't know why it worked. We didn't know the effect it had on blood clotting or prostaglandins. Vitamins, there were the only pure vitamin in 1939 when I graduated was ascorbic acid. Vitamin K was unheard of, and that's why people died of following gallbladder surgery from hemorrhage, because nobody realized that there was a prothrombin problem. Amazing. Of course, along bloodlines is the improvement in treating hemophilia with a special factor.
Did you always have access to the drugs you wanted to use?
Yep. I was on the staff at Memorial Hospital, which was a very, very good hospital with all sorts of opportunities for everything. I did gastroscopy, and they bought a gastroscope for me. It was a very, very good hospital.
What breakthroughs in drugs have you seen during the course of your career, and when did they occur?
Well, I mentioned vitamins.
Yes.
We now have purified vitamins of just about every vitamin that exists, and that's made a big difference in a lot of situations. The antihypertensive drugs I mentioned, antihistamines. There was no such thing as an antihistamine. Now look at all the things you see advertised over the radio and magazines. Antibiotics, steroids, and the NSAIDs, non-steroidal anti-inflammatory drugs. They've all played a big role in the wonderful way medicine has improved over the years.
How did patients without money get health care? Next page.
I never saw anybody or never heard of anybody in Worcester suffering from lack of care. People would come to the emergency ward and they'd be treated. I was on the staff of City Hospital for a while, and I saw all sorts of poor people in the outpatient there. If they couldn't pay, nobody seemed to bother in those days. I never heard of anybody not getting treatment.
How about in disease prevention, though? Because obviously if somebody's in the emergency room with something that needs to be treated, they will get help, but in matters of preventing a disease or treatment over a long period of time, did people always get care even though they didn't have money?
Yeah. Some people had a stack that high of records in the outpatient. They'd come in once a week or more, and then they were never turned away. They got continued treatment.
Over the years, how do you think Worcester compares to other places in terms of providing care for the underserved?
I think Worcester has been fortunate in having excellent hospitals and doctors, and then, of course, with the advent of the medical school, it's even better. Worcester's a good place to live, health-wise.
What were some fears and concerns about socialized medicine in the 50s and 60s? Socialized medicine.
I really didn't have much of a problem with it. As a doctor, I was annoyed that Medicaid paid so little for people. But if somebody came to my office and said they couldn't afford to come back, I'd say come back anyway. It won't cost you anything. I think in those days we took care of charity patients for free, so to speak. I never refused to see anybody because they couldn't pay.
Were physicians involved politically on the topic of socialized medicine?
What's that again?
Were physicians involved politically on the topic of socialized medicine?
Not to a great extent. My friends and associates didn't pay much attention to the politics of medicine. Everybody's obviously against socialized medicine, but they didn't do much about it.
What were your feelings on Medicare and Medicaid when they came into being in the 60s?
Well, I thought it was probably a good thing in the long run. A lot of people didn't have health insurance. I thought it was a good thing.
How do you feel about the programs now?
Well, I think it's tragic that the Medicaid can't pay hospitals and doctors enough to keep things really financially stable. Hospitals have had to cut down on a lot of things that they didn't want to do because of that. Doctors have to see so many patients, they can't spend the time that they really need to understand a person's problem.
Do you think the government has become more or less involved in healthcare?
I sure do.
More involved?
It's more involved, much more involved.
And how do you think that has affected physicians?
It's affected physicians in an unfortunate way. they don't get paid as much as they used to. And the result is they have to see more patients, which means that they spend less time with any one patient, and that's where the patients suffer. I could never survive in today's world. I used to spend so much time listening to people talk about their problems.
So you had more of a personal relationship with your patients?
Absolutely.
You can't do that today, really.
Yeah.
What would you like to see happen with government in healthcare?
I'd like to see him put more money into Medicare and Medicaid. That would be the biggest thing they could do.
When did HMOs first start to impact your practice?
When?
Yeah, when?
Oh, I've forgotten. I don't know the date. I never paid much attention to it, as a matter of fact. I had a private practice that was more or less independent of HMOs and Medicare and Medicaid.
Okay, so they did not impact you a lot?
No, not much.
Do you have any opinions on the positive or negative aspects of HMOs?
Well, along the same lines as I've already mentioned, it's causing doctors to spend so much time seeing a lot of people instead of a lot of time with a few people. I think that's the biggest thing. Doctors are overwhelmed with paperwork. They have to have more secretarial help. I got along, I was practiced solo, and I had one girl in the office, not a nurse, and she was able to handle everything there was. Today, I don't think one girl could handle it, the paperwork. Terrible.
Okay, moving on now. How much did it cost for you to go to medical school?
$800 a year.
Obviously, medical school costs much more today.
Oh, Jesus.
How much, how do you think, how do you think school costs today influence the choices of young doctors after graduation compared to when you practiced?
Well, I think a young man going into medicine today has really got to want to be a doctor, because unless they have their own access to funds, it's going to cost them about $100,000 to get an education, and those guys are going to come out hugely in debt. And I don't think a lot of young men are willing to do that. But a guy who really is interested in the science of medicine and wants to be a doctor, he'll do it. It's a tough situation today.
How have doctors' salaries changed over the course of your career?
I never was on a salary. I was solo, and I was paid for office visits and house visits, and my hospital patients either paid or their insurance paid. And as I told you earlier, I had a salary, a monthly salary from the Morgan Construction Company. And after I retired from practice, I worked about 14 hours a week, 12 to 14 hours a week for Mass Pro, Blue Cross, and Memorial Hospital utilization, and my take-home pay was more than I worked 60 hours or more a week in practice, because I had no expenses.
How has malpractice insurance changed over the years?
Oh my goodness. When I started in malpractice insurance, didn't cost much over $100. And over the years, it didn't change much. But then when I began doing gastroscopies, they said they wanted to increase the malpractice insurance. So it went up to about $150. And almost on a straight curve every year it went up. The last year I was in practice, malpractice insurance was $1,500. I never had a malpractice suit, but that was the way it was, and if I'd continued another year, it would have been over $2,000. Terrible way malpractice has been causing the cost of medicine. I understand that some doctors are charged over $100,000 a year for malpractice insurance in certain states.
How did you learn the business of medicine?
How did what?
How did you learn the business of medicine?
The hard way, by experience.
Yes.
And I'd talk with my friends, what were they doing? How were they doing this or that? I always had an accountant to check on things, make sure the office was run correctly, and so forth.
Do you think that medical school should focus a little more on the business side of medicine so that young doctors will not have to learn by themselves like you did?
Yes, I think they could have a short course in the economics of medical practice.
In the Worcester community, what are some changes that you've seen in the demographics?
There's been a significant increase, mostly in Puerto Ricans and Cubans, Latin Americans, and blacks. And in even more recent years, Vietnamese.
Yes. Has the ethnic background of your patients changed at all over the years?
No, it didn't change. I had blacks, I had Irish, I had Poles, Lithuanians, Latin Americans, Swedes, just about a cross-section.
How did women's health in Worcester change?
How's what?
How did women's health change in Worcester?
I never paid much attention to women's health as a special problem. I had a lot of women in my practice, and I wasn't aware that they had a special problem, but now I think there's perhaps an overemphasis on women's problems as a specialty. I didn't notice it as a special problem during the years I practiced.
Have there been changes in how children are cared for?
Not to my knowledge.
How has Worcester been different from other places that you've practiced? Have you practiced anywhere else besides Worcester?
No.
Okay.
I don't know how to answer that because I have no way to compare.
Okay. What were public perceptions of doctors back when you practiced?
Doctors were very highly respected, and over the years, I think that is somewhat diminished, unfortunately.
How do you feel the role of the physician in the Worcester community has changed?
I'm not sure it's changed at all. The big change is that doctors now are in groups. I was solo,
Yeah.
and there are very few solo doctors now. The result is that if you go to a doctor who's in a group and you're sick, you might get one of his associates if he's not on call. That's been probably the biggest change in the way medicine is practiced in Worcester. When I started practice, everybody was solo.
Are there Worcester physicians that you admired when you started practicing?
The what?
Were there Worcester physicians that you admired when you started
Oh,
practicing?
yes.
Anyone in particular you'd like to mention?
Well, Dr. Dunlop, George Dunlop, was very much admired. Dr. Benjamin Alton, who was chief of surgery, very, very fine doctor. Dr. Donald Height, surgeon. Those were the main, and Dr. Edward Budnitz, who was one of my instructors at Harvard Medical School, was practicing here. He and Dr. Benjamin Carr were very helpful to me, not only in learning from them, but in helping them with their practice in the early years.
And how about now? Are there physicians that you admire now?
Around here?
Yes.
I've been out of contact with the practice for 10 years, so that I can't answer that question.
Okay. What was it like for the female physician in Worcester in the 50s and 60s?
What was it like?
For the female physician in Worcester during the 50s and 60s?
At that time, there were only 2 or 3 women doctors, Dr. Grant and Dr. Bertha Olson. And then there was another woman doctor at City Hospital who I didn't know. The 2 women doctors that I knew, both at Memorial, were appreciated by a lot of people, particularly women. They didn't participate much in the activities of the hospital, so I can't answer too much about their practice, but they were popular.
And how has the experience for the female physician changed since then?
Well, today it's entirely different because there are so many female medical students, and over the last 20 years of the medical school, we had female interns at Memorial, and we got to know them. They would graduate, join the staff, so that over the years, the girls have become very active and a prominent part of the medical community, and they're doing a good job.
How did group practices or hospitals treat minority physicians?
Very poorly. 40 or 50 years ago, there was a black doctor who tried to get on the staff at Memorial every year and was turned down. That would never happen now.
Yes.
He had I'm not sure he was too well qualified, but he never got accepted on the staff.
What do you like best about practicing in Worcester? Or what did you like best about practicing here?
What did I like best?
Yes, about practicing in Worcester.
I like the fact that I could get to know my patients by virtue of house calls. I had a lot of good friends in business positions, banks, who would refer me patients. And at one point I had over half the trustees of the hospital as patients. I was very fortunate in the people that I knew and took care of.
And what do you like least about practicing in Worcester?
What do I like least?
Yes.
I never thought of it. There's nothing that I really thought of that I didn't like.
That's good. Okay, before we wrap up, would you like to share anything from your experiences in World War II related to medicine or anything like that?
As I might have mentioned, I was at Pearl Harbor on a hospital ship the day the war started on December 7th, and I took care of burn patients and shell shock patients. The amazing thing to me was the horrible effects of acute hysteria, which is what shell shock is. Patients with, I can remember one patient that was entirely numb all over his body. Another patient couldn't speak. Another patient couldn't see. Terrible things. Then, in regard to burns, we were back in the days of the Dark Ages as far as treating burns were concerned, using eschars. And I had one guy who had extensive body burns, and it was, for 3 weeks, it was torture treating him because of the eschars. Later on, I was down in the South Pacific when a destroyer blew up and there was some steam burns. And by that time, the University of Pennsylvania Medical School had come aboard, and they began to treat burns in a more humane way. And ever since, burns have been much more successfully treated. The war was quite something. I had one experience when I was at a hospital in Brooklyn, in Jamaica, Long Island. I was in charge of contagious disease wards, and I saw more measles patients than I'd ever seen before, more mumps. And one measles patient came in with critically sick with a temperature of 106. We had nothing to treat measles with, but I'd heard about convalescent vaccine. So I went into Bellevue Hospital, where I knew they had some, and I got some of this convalescent vaccine and gave it intravenously. It was convalescent serum, not vaccine. And gave it to this guy. His temperature came right down. He went on to heal. I've never heard of anybody using convalescent serum for measles, but there it was. I saw mumps encephalitis. In fact, I wrote a paper on it. And very, very interesting experiences in diseases which I practically never saw in practice.
Okay. And lastly, what advice do you have for younger doctors, Dr. Carlton?
What advice do I have?
Yes.
Oh my, keep up with all the new things. That's the most important thing, because what I was taught in medical school isn't what I end up using. You learn as you go along. We had weekly teaching sessions. Doctors from Harvard would come up and give us a couple of hours every Wednesday morning, and that way we could keep up with the news. And then one other way you can learn a lot is from the detail men, the representatives from pharmaceutical companies who bring in new drugs. I would say that for a young doctor, the most important thing was to keep current.
Okay. Well, thank you very much, Dr. Carlton.
You're welcome. I enjoyed very much the opportunity to say some of these things that it's been a wonderful career.
And do you think you would do it all over again right now if you had the chance?
I don't know. Not if I had to spend $100,000 to get
That's right.
the education. But I've enjoyed very, very much being a doctor in my lifetime. We had the golden years of medicine. I don't know what it's going to be like in the future, but there'll be so many new things coming along, what with genetics and all the fancy new drugs that it's amazing.